Hi, this is my week 1 video journal. Describe my clinical experiences so far in the program. My first clinical I did with a therapist, learned a lot about psychotherapy modalities, mostly CBT, DBT, and some psychodynamic therapy. It was a great introduction to the course and the clinicals. And my second one I did with a psych mental health nurse practitioner. She was excellent, saw patients for therapy and med management, saw all ages. So I got to experience the pediatrics through to the older adult population, even some patients with dementia. The majority of them were young adults, and some adolescents for multiple health diagnoses, lots of complicated cases, a lot of patients on a lot of different psychotropic medications. So it was really interesting to see her manage these patients and help me with managing the patients. And concerns I have. I skipped it. What are the reasons I chose to work with the population? I'm a family nurse practitioner. I've only been a nurse practitioner for 2 years. Before that, I worked in the ER for quite a few years and then a few other places as a registered nurse. But just over my work experience, I've seen the, desperate need for mental health providers. So many patients in primary care have come in for physical symptoms or somatic complaints, and it ends up being a mental health issue. And I just felt like I wanted to be better prepared to help and learn more about the resources for these patients, and learn a lot about the medication management, and it can get pretty complicated. I've already seen with all the different medications, and a lot of patients have comorbid conditions, multiple psychiatric diagnoses. So it's nice that I have the FNP background as well, because it helps me kind of know some of the interactions a little bit more and what to look out for. And concerns I have, I think my biggest concern with this specific clinical course, it's my last one, so I just want to kind of hone in on my skills, work on medication management with complex cases, and just kind of working on better communication, establishing therapeutic relationship, and those sorts of things. And identify personal, academic, professional goals. So I plan on completing the course in June, and hopefully I can pass the test without any issues. And I'm working in primary care, and I also work in telehealth, so I would like to transition to a more permanent psych mental health nurse practitioner role, of course, after this. And it would be nice to do a little bit of telehealth, but also in person as well, especially as a new provider starting out. Specific goals for this course, like I said before, just kind of getting to know medication management a little bit better, especially in complex cases. And what strengths and weaknesses do I have? Weaknesses would be just that I'm still learning a lot about these mental health diagnoses and the complexity of the cases and all the medications. And the strengths, I do have a decent amount of clinical experience outside of psych, so that is helpful. Thank you.